As our population in the UK ages and our desire to remain at home as we grow old increases, we're forced to look at new ways of delivering social care, which is exactly what health tech company Kraydel is hoping to deliver through its new user-friendly remote monitoring system.
70% of the people over 75 live alone. That means these are the elders that have spent their entire lives looking after dependents and contributing to the economy are abandoned in their vulnerable later years. Kraydel's objective is to stop that and allow the elder to get connected back into the community and stop isolation. It's terrible that these people are feeling alone and dying of loneliness.
From a provider perspective, my main focus is on the quality of care and the carers being there at that time to provide the greatest standard of care to our loved ones. However, technology just goes to reinforce, enable and create more efficiencies in delivering care so that we can keep connected to our loved ones when we don't have the capabilities to have a carer present in the home.
RGAX is the innovation lab that's associated with RGA. It was set up to try and make people's lives better, to provide people with an opportunity to live longer, healthier, happier lives everywhere in the world. What we really liked about the Kraydel product was its use of the TV. The TV is something that's in everybody's home. It's something that everybody's familiar with, and it offers a really good opportunity to have a two-way conversation with individuals. We think that that is something that's actually hugely important, because it's not only about trying to monitor people, but it's also trying to have a discussion and a conversation with people to allow them to help improve their lives for themselves.
Kraydel is a small little box that sits on top of the TV, and it sets itself up in the time that it takes to boil a kettle. Even though we use the best of artificial intelligence, the best of cloud computing and machine learning, that's all in the plumbing, that's hidden. What the elder sees is a small box, just like an old VHS tape, and a bog standard remote control with buttons they can push. Our job is to give them access to state-of-the-art technology, but make it really simple and easy to use.
I was a carer for my grandma for 12 years. I witnessed the massive amounts of pain points in looking after your loved ones at home. The thing about Vida is that we're developing the logistics to actually get the carer to the door. And for us, working with people like Kraydel is that extra step to keeping people connected to their loved ones in a manner that we can't actually do. If I'd had this when I was looking after my grandma all those years ago, it would have meant that our lives were made so much easier. But as a provider, it means that we can link into this for our clients and go above and beyond in providing a service that all of our loved ones deserve.
We know we have a huge issue with social isolation, and we know people are dying from loneliness. By putting a Kraydel in the home, we are extending the living room into a virtual living space. We are connecting the elder with their loved ones. They're going to be able to make real-time connections. They're going to be able to get connected back into their community. In this way, we see us fixing the mental wellness of the elderly, and we think this alone will have a huge impact on all the health complications of being lonely.